Emer's office, and right now we have our patient. It's probably been just over 12 hours since we ended surgery. This is not even 1 day after, this is 12 hours after surgery. And look at our patient right now. Barely any bruising, a little bit swollen, but that is 1 day after supermodel lipo in the office. So if you look at her right now, we're doing our massages. We just did our hyperbaric oxygen chamber, and we're gonna do an IV soon. So if you look right here, she's already really slim. The point of this case was not to debulk. This is for sculpting and skin tightening. If we go right now, I'm gonna pinch her skin, tight everywhere, very tight. That was the purpose of this case. She did have lipo before, as you can see. It did leave her a little irregular. You can see right there on the belly button. Everything now, perfect. Go look at her right now. So with this being a sculpting case, that requires a lot of very meticulous liposuction. And it has to be very meticulous because when someone is this slim, any minor imperfection is going to show through very easily. So right now you don't see the etching, you don't see the lines as much. So I have a patient with a similar body type on our iPad, and I'm going to show you what we can expect. This is slim supermodel lipo. So someone like this does not have definition, didn't have any lines, and then over here you can see she's much more tight, much more defined. And right here as well, we brought everything in, made her nice, tight, sculpted, gave her some muscle definition. What we did here, we did lipo, Renuvion, Vaser, and we did some fat grafting to the hip dips. On the back side, you can't see it right now, but we did some body tight to her buttock roll and her outer thighs. And a common concern right here, so if we look at the butt, and we'll talk about this. This pocket right here is not often fat. That is usually loose skin, and what that requires is skin tightening. So that's why we use body types from our focused internal heating to tighten that up, lipo out the melted fat in the area, and then we do it on the buttock roll as well, just to give her a nice little lift. That's a good alternative to someone that doesn't have a lot of laxity, but they need some lifting there, so we don't have to do the spiral thigh lift on her. And then we did some fat grafting right here in the hip dips. She did not want to be bigger, she just wanted a little more curve right there. So we'll come over here, let's check it out. Do you have any questions?
What non-surgical procedures can we combine this with?
So that's a great question. A lot of non-surgical procedures we combine this with is going to be our skin tightening, such as microneedling RF. We love our Pixel device, TrueSculpt ID, and Flex. We can use body tone. Peptides as well are really going to help get you in shape and ready for something like this. And most importantly, when we do these kind of procedures, we do make you have to do aftercare, which is going to be lymphatic massage for 10 to 14 days, hyperbaric oxygen chamber, and IV therapy. Our massage first over here. He's been massaging here right now. He's got all this everything out. And he can explain what a lymphatic massage is and the importance.
Yeah, well, this is something that's extremely important when you're working with some post-operative cases such as this, where you're going to have an increased amount of fluid accumulation into the pockets of skin, where anything that gravity is pulling on, we're going to work against and push it right back up through the tissue, up and around. And for instance, then we have a couple of drains here that then we're going to push it back through and move it out. Now, most of the work's already been done today on her, but in certain cases, right after, we can sometimes see a complete stream of things, maybe 8 ounces in a 30-minute session. So we're really moving a lot through here. But essentially what we're doing is we're trying to minimize the scarring that may come about, but at the same time, we want to also just improve the healing time by continuously pushing the fluid back out where it needs to be, and then letting the body go through its normal unwind through the inflammatory processes. So yeah, in a nutshell, you got to do it 3 to 10 sessions after a series of treatments like this, and you'll be in good shape.
Yeah, and that's really great. So that helps prevent any seromas, helps reduce the rate of any complications happening. And we pretty much require here, if you're going to do surgery with us, we want you to get the best results. There's no reason you should invest in in the surgery and not get the aftercare, because that can compromise your results. So it's very important here that we do that. If you guys don't have any questions, we're going to tune off right now, but let me give you one quick recap. So we did slim supermodel lipo. This patient is probably about 12 to 13 hours post-op. We're doing aftercare, as you can see right here. She had previous liposuction, didn't give her the results she wanted. She wanted to be tight, slim, sculpted, and that's exactly what we did in our office procedure. Right there, we did torso, circumferential thighs right here to bring everything in and tighten it. And we can look overhead, show them, Cameron. And then we did some fat grip to the hip dips. And we did do some body tight to the buttock roll and outer thighs. So over the next coming days, we'll see the swelling go down. Over 3 to 6 months, we'll really start to see her skin tighten even more and the lines come in. And we'll show you her healing process. Thanks, guys.